Hello, it's Dr. Eric Thomas, and I will be speaking on the coronavirus disease 2019, the COVID 19. First thing I would like to address is how do we protect ourselves? Older adults and people who have severe underlying chronic medical conditions such as diabetes or cancer are at a greater risk for acquiring the disease. Um, the other issue is knowing how it spreads will also help us to protect ourselves. There's currently no vaccine. The best way to prevent it is to avoid being exposed to the virus. And the virus is thought to be spread by person to person contact, primarily between people who are within 6 feet of each other. It's also spread through those respiratory droplets in that 6 foot range, such as when a person coughs or sneezes. Those droplets unfortunately can land in the mouth or nose of people nearby. So, what steps can you take to protect yourself? Wash your hands often with soap and water for at least 20 seconds, especially after you've been in a public place or after blowing your nose, coughing, or sneezing. If you don't have soap and water available, you can use a hand sanitizer. But you want to make sure that the hand sanitizer contains at least 60% alcohol. Avoid touching your eyes, nose, and mouth with unwashed hands. Uh, Avoid close contact. Again, put distance between yourself and other people. If the COVID 19 is spreading in the community. Um, Stay at home if you're sick, um, except when you need to seek medical care. But for minor ailments, um, it's best to go ahead and stay at home to avoid exposing others. Again, cover coughs and sneezes. Cover your mouth and nose with a tissue when you cough or sneeze, and also sneeze into the inside of your elbow. Throw the used tissues in the trash, and immediately wash your hands. And again, you want to wash your hands for at least 20 seconds. If you are sick, you want to wear a face mask when you go to your doctor. Um, Also, face mask when you're around other people, or if you're sharing a vehicle with someone who's sick. If you're not extremely sick, there's no need for a face mask unless you're caring for someone who's sick. Again, close contact with a person who's sick with the COVID 19. You want to clean and disinfect frequently. Um, Such tables, doorknobs, countertops, phones, keyboards, toilets. And you want to do this, clean those surfaces at least twice a day or more. So, what are the symptoms to watch for? Fever, cough, and shortness of breath within 2 to 14 days after an exposure is what you're looking for. Um, when is it considered an emergency situation? When the shortness of breath becomes extremely continued, extremely worrisome, or there's persistent pain or pressure in the chest. Also, there's a new sort of patient, the person becomes confused or difficulty to arouse, or there's a bluish color to the lips and face. So, other things to consider um, is as a faith based organization, how do we prepare for any sort of outbreak? One way we can do that is by establishing a checklist for what we would do in case of those type of emergencies. So the one of the first things that we would do, um, according to our checklist, will be to establish communication with our public health department to facilitate relevant information before and during an outbreak. Um, if there's any sort of community-wide planning, we want to make sure that we're connected to that. Um, any emergency operations, want to make sure that our plans are updated. Maybe even designating an emergency operations coordinator as well. Want to consider the needs of our elderly patients um, since they are in the highest risk group. Also consider the needs of any of our members with disabilities as well. Want to make sure we have established relationship with community partners and stakeholders, such as your local doctors, nurses, people that can get information to our organization quickly. Um, Another thing, we want to identify services that might be limited or temporarily discontinued during an outbreak, and some alternative solutions for that um, as well. Um, as an organization, we want to promote the practice of everyday um, preventative protective actions. Again, such as washing the hands for 20 seconds, coughing inside the elbow, covering mouth and nose when sneeze, maintaining approximately 6 feet um, between the next person, and then having, if a person is sick, staying at home, or also that sick person would wear a mask as well. As an organization, we may consider having masks on hand, having a number of supplies that are readily accessible for our organization. If we notice that any members are missing, or someone that usually shows up, or they're not in their usual place, they just don't seem right, sort of planning for trying to find out what's happening to the person, what's going on, and how we can help as well. If there's any staff absences, members of the church staff that are absent, maybe develop a method for monitoring and sort of tracking their absences in light of the COVID-19. um, Also, as an organization, we may need to identify a space where we could separate sick from non-sick in case an outbreak does develop. And then, lastly, we want to make sure that um, although there's the possibility of an outbreak, life does go on. We're a faith-based organization, and so come up with a plan to continue our mission. just bringing souls to Christ, even in the midst of this potential outbreak. And again, I think that would involve close networking and sort of knowing where our members are and what's going on with our members, and just being available to help.